Is your eyelid twitching without your control? Is your face also being pulled to one side when the eye twitches? Are you watching this because you're embarrassed by it? Don't worry, you're not alone. Most of the times it's harmless, but sometimes it's the first sign of a condition called hemifacial spasm, where twitching can spread to one whole side of the face. Watch till the end to know why it happens and how to treat it. I'm Dr. Jaydev Panchwagh. I'm a neuroanesthesiologist and perioperative physician, and I work closely with Dr. Jaydev Panchwagh, a neurosurgeon. For over 30 years, hemifacial spasms has been one of the main problems we treat, from the first very tiny twitching to very severe facial spasms. This video is for patient education. If you have new, persistent, or spreading twitching, it's worth getting checked by a doctor experienced in dealing with such nerve disorders. Most eyelid twitching is something called myokymia. It's extremely common and usually harmless. It often shows up when life is doing life. Stress, tiredness, too much caffeine, nicotine, eye irritation, or dry eyes. And most cases settle down on their own, often in days to weeks. Commonly, hemifacial spasm is misdiagnosed as Bell's palsy, which is actually facial paralysis on one side. Sometimes it is also mistaken for synkinesis, which happens when the paralysis slowly recovers but has led to abnormal nerve muscle connections, leading to synkinesis. So, how do you differentiate between Bell's palsy, synkinesis, and hemifacial spasms? Here's the key difference. Hemifacial spasm is typically one-sided facial twitching that can start near the eye and then spread down on the same side toward the cheek, mouth, or the neck muscles. It can also happen more often over time, and some people even notice it during sleep. Often, the spasms become more frequent in stressful situations or during anger or while being photographed, exactly when you don't want them to occur. Sometimes it is also associated with a buzzing or clicking sound in the ear, which is called tinnitus. In many people, the cause is mechanical. A blood vessel is pressing or rubbing on the facial nerve where the nerve exits the brainstem. That repeated irritation can trigger unwanted signals and the face muscles contract. Less commonly, other causes like prior facial nerve injury or a growth can do it, which is why a proper evaluation matters. Now, the important question is when to get checked. Consider getting checked if the twitching is persistent or keeps coming back, it's pulling the eye shut or affecting the speech or your chewing, or it's clearly one sided and spreading beyond the eyelid and going downward. At our MVD center in Pune, we usually start with a careful history and exam, and many patients will have MRI based imaging to look for the typical nerve blood vessel contact and to rule out uncommon secondary causes. This is exactly where experience helps, because small details in the pattern of twitching can point you in the right direction early, and correct interpretation of the MRI needs to be done by a radiologist experienced in hemifacial spasms. The treatment options for hemifacial spasms are several, but the most effective solution is MVD surgery, and I will talk about it in detail later. Initially, most people want medicines or tablets, so option one, tablets. They have a limited role. Some oral medicines can help a subset of people, especially early or in mild cases, but they're often less reliable than injections or surgery. Option two is botulinum toxin injections or botox injections. For a few patients, the next less difficult step is botulinum toxin, where injections are made into specific facial muscles. This does not cure the cause, but it may control the spasms to some extent initially. Effects typically begin in a few days and last about 2 to 3 months, so it's repeated on a schedule. There are many variables here: the brand, the quality of Botox, the person administering it, their experience, etc. But generally speaking, even if you have the best brand given by the best doctor, the effect is temporary. Hemifacial spasms always come back. The third option is microvascular decompression or MVD surgery. It is long term and generally a curative option for many. If the main problem is nerve compression by a vessel, the only treatment that addresses this cause directly is microvascular decompression or MVD. In this surgery, the surgeon reaches the facial nerve area from behind the ear and places a small cushion between the vessel and the nerve to stop the irritation. In our large neurosurgical series of treatment of hemifacial spasms by MVD, we have found that MVD surgery can be a durable long term solution, but it's still brain surgery. So we always balance the expected benefit against the risks. So serious complications are extremely uncommon, but potentially possible. That is why patients should select the neurosurgeon who has a large experience in dealing with MVD surgery for hemifacial spasms. Another very important reason to spend time doing research and selecting your surgeon is to have a successful outcome, that is, relief from the spasms. After all, that is why you want to get operated for, right? So, in summary, most eyelid twitching is harmless, but if twitching is one sided, spreading and getting more frequent and more intense, or sometimes it is associated with a buzzing or clicking sound in the ear, think of hemifacial spasms. And the good news is we have strong evidence based options for long term relief, which is microvascular decompression. Because our team at the Center of Excellence for MVD Surgery at Pune has focused on hemifacial spasm for over 30 years, we have seen the full range from mild cases to complex ones. And we tailor the plan to what fits you best. If you are interested in this and other topics like these, please subscribe and leave a comment in the section below, and you will be notified when we make a follow up on what to expect in a consultation and in MRI. Thank you.